basic issues like being depressed or being, having personality disorders, and also, things like OCD and ADHD, and of course leading up to schizophrenia and more complicated illnesses, mental health illnesses, all are, becoming part of, the discourse of in wherever you go today, whether it's in the corporate sector, whether it's in schools, whether it is in governments, everywhere these issues are cropping up. And there is a need because of the way society is changing. I think the evolution of society is also contributing to the increase in mental health issues. The access to information and peer pressure and competitive spirit and trying to, the pressure to excel, the pressure to do well is also contributing. And addictions, various forms of, addictions, whether it is drugs or whether it is, even digital addiction is becoming a huge issue. And in fact, Supreme Court recently, they came out with an order saying that all schools should have, space for children to be counseled. And they should have some facility where they can, look at the children, observe the children, and see if there are, if there are some issues with them, and address that. And they're mandating it for all schools. So you can see the impact that it's having, right from young children, because of so much of information flow that's happening, and so many things have got connected. The stress levels have gone up, sleep deprivation has gone up, and all these things are contributing to, impact on our brain functioning and impact on our mental health. So it is definitely a serious issue, and we have to address it across all sectors. And specialized care is also needed. I think this Amaha center will be able to give specialized care where, for extreme cases, where in-house patients need to stay and they're monitored and they're taken care of, and find a way out for them, because solutions are not easy. It is all very, it's not as simple as treating maybe a heart attack or cardiac arrest, where you have a fixed solution. Here it is the human emotion, and there's a lot of in-depth analysis, and of course proper use of medication, proper use of drugs. Things, even if it's done improperly, can also have a negative impact. So there are so many issues which are connected to this, and I think we need.
He's a dear friend. So, and of course our health minister of Karnataka. And I don't know how many of you have noticed, but a lot of changes that he has brought in, and my most favorite one is the one where he has stopped food coloring in, which is maybe a small impact, but definitely something that is going to go a long way creating good health for all of our children. Ivattunuve mental health ಬಗ್ಗೆ ಮಾತಾಡಬೇಕು ಅಂದ್ರೇನೆ ಇವಾಗ even I'm working in a corporate organization, and even in my organization today, pre-COVID, people would not come forward very easily and talk about these things. It was still a stigma, but I think COVID has somewhat changed some of this. I think during COVID we saw a big explosion of issues, and I think people have come forward to address it head on. So one of the things, my request to Amaha is, yes, it's a fantastic care facility you're providing, but also somewhere along the line, make sure that you're also thinking of people who have issues with affordability. They are the most, they are probably the section where it is least spoken about, and they tend to brush it off as not a problem, right? Where people who have the means and the affordability will at least address it, but where they have an issue with unable to meet a doctor or meet a practitioner, they will brush it off as as if it is not an issue. So somewhere along the line, if you address the challenge of affordability, I think more and more people can get help. This sought after, this is where we need to start helping society around us. So I'm happy all of you have come.
ನಾವಿನ್ನು ಗ್ರಾಮ ಮಟ್ಟಕ್ಕೆ ತಾಲೂಕು ಮಟ್ಟಕ್ಕೆ ಹೋಗಬೇಕಾದ್ರೆ ಶುರುವಾಗಿಲ್ಲ, ಯಾಕಂದ್ರೆ ನಮಗೆ ಟೆಕ್ನಿಕಲ್ ಪರ್ಸನ್ ಸುಲಭ ಸಿಗೋದಿಲ್ಲ. ಬಟ್ ಒನ್ ಥಿಂಗ್ ದಟ್ ಯು ಡನ್ ಆಲ್ಸೋ ಅಕ್ರಾಸ್ ದ ಸ್ಟೇಟ್ ದಟ್ ಯು ಲಾಂಚ್, ಈಗ ಗೃಹ ಆರೋಗ್ಯ ಅಂತ ಲಾಂಚ್ ಮಾಡಿದ್ವಿ. ಯು ಗಾಟ್ 14 ಪ್ಯಾರಾಮೀಟರ್ಸ್ ಇನ್ ದಟ್. ಅದರಲ್ಲಿ ಒಂದು ಪ್ಯಾರಾಮೀಟರ್ ಅಂತ ಹೇಳಿದ್ರೆ ಮೆಂಟಲ್ ಹೆಲ್ತ್ ಇಶ್ಯೂಸ್. ಲುಕಿಂಗ್ ಅಟ್ ಮೆಂಟಲ್ ಹೆಲ್ತ್ ಇಶ್ಯೂಸ್ ಟು ಟ್ರೈ ಅಂಡ್ ಐಡೆಂಟಿಫೈ ಈ ಮರುವಾಗುವಂಥದ್ದು, ಡಿಮೆನ್ಷಿಯಾ ಆಗುವಂಥದ್ದು, ಸ್ಟ್ರೆಸ್ ಇರುವಂಥದ್ದು, ಡಿಪ್ರೆಷನ್ ಈ ಥರ ಇರುವಂಥದ್ದು ಸೊ ಐಡೆಂಟಿಫೈ ಮಾಡೋದಕ್ಕೆ ಟ್ರೈ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಸೊ ದಟ್ಸ್ ಬಿಕಮ್ ಪಾರ್ಟ್ ಆಫ್ ಅ ಪ್ರೋಟೋಕಾಲ್. How effectively it is implemented is another thing. But at least we made it mandatory to look at these aspects when our ASHA workers and our CHOs and our our what we call as PHCOs or auxiliary nurses, midwives, when they go around to look for these symptoms at least, and try to educate our own staff to how to look for these aspects. So this is also what we are trying across our general population, and provide them some sort of counseling and treatment. So this is another thing that we are looking at.
Formally acknowledge senior clinicians that are here today, and the members of the wider mental health community. Right? People have been working in mental health for decades now. Many of you spent decades building and improving and holding together this ecosystem, and you've just shown up now. Right? In the last 10 years, you've just shown up. Because you've done it with quiet rigor, done it with deep care and an unwavering belief in dignity. Right? So you've laid the path for us to walk on, and for that I'm very, very grateful. And we are here today not just as Amaha, but also part of a larger family, one that includes Children First, which is our child and adolescent mental health team, and India Mental Health Alliance, which we co-founded with the aim of strengthening and collaborating with the broader mental health community, right? So just to push for the cause of mental health. Across each of these efforts, our intention is the same: to coordinate to a future where every person across every age and background has access to care that is compassionate, continuous and grounded in evidence. Because it's very, very important, as I was saying, to give the right care. I also want to express a deep gratitude to our investors and partners, many who are here today. Your belief in this mission, long before it was becoming real, has been a big source of support to us, so thank you very much.
ಮಾನಸಿಕ ಆರೋಗ್ಯದ ವಿಚಾರದ ಬಗ್ಗೆ ಈ ಒಂದು ಕೇಂದ್ರವನ್ನು ಓಪನ್ ಮಾಡಿದ್ದಾರೆ. ಇಲ್ಲಿ ಪೇಷಂಟ್ ಔಟ್ ಪೇಷಂಟ್ ಇಬ್ಬರಿಗೂ ಅವಕಾಶ ಮಾಡಿಕೊಡ್ತಕ್ಕಂಥದ್ದು. ಇವತ್ತು ಮಾನಸಿಕ ರೋಗಗಳು ಮತ್ತು ಮಾನಸಿಕ ಅಸ್ವಸ್ಥತೆ ಆಗ್ತಕ್ಕಂಥದ್ದು ಹೆಚ್ಚಾಗ್ತಾ ಇದೆ ಮತ್ತು ಸಾರ್ವಜನಿಕರಿಗೆ ಮಕ್ಕಳಿಂದ ಹಿಡಿದು ವಯಸ್ಸಾಗಿರೋರು ಕೂಡ ಇದರ ಭಾಳಷ್ಟು ಅಗತ್ಯತೆ ಇರ್ತಕ್ಕಂಥದ್ದು. ಆದ್ದರಿಂದ ಖಂಡಿತವಾಗಿ ಈ ರೀತಿಯಾದಂಥ ಸೌಲಭ್ಯಗಳು ಹೆಚ್ಚಾಗಿ ಸಿಗಬೇಕಾಗ್ತದೆ ಮತ್ತು ಇದರ ಅವಶ್ಯಕತೆ ಬೇಡಿಕೆ ಎರಡೂ ಇದೆ. ಇದು ನಮ್ಮ ಸರ್ಕಾರದ ವತಿಯಿಂದ ಕೂಡ ಅನೇಕ ನಾವು ಇದಕ್ಕೆ ಮಾನ್ಯತೆ ಕೊಡ್ತಕ್ಕಂಥ ಮತ್ತು ಇದ್ರ ಬಗ್ಗೆ ಗಮನ ಕೊಡ್ತಕ್ಕಂಥ ನಾವು ಮಾಡ್ತಾಯಿದ್ದೀವಿ. ಮತ್ತು ಈ ರೀತಿ ಖಾಸಗಿ ಸಂಸ್ಥೆಗಳು ಕೂಡ ಹೆಚ್ಚಾಗಿ ಬರ್ತಾ ಇದೆ. ಡಿಮ್ಯಾಂಡ್ಸ್ ಅಂತೂ ಇದ್ದೇ ಇದೆ. ಅದ್ರ ಜೊತೆಲಿ ಈ ರೀತಿಯಾದಂಥ ಬಂದಾಗ ಭಾಳಷ್ಟು ಜನರಿಗೆ ಇದರ ಅಗತ್ಯತೆ ಇರೋದ್ರಿಂದ ಇವತ್ತಿನ ಒತ್ತಡದ ಜೀವನ ಶೈಲಿ ಮತ್ತು ಇದೆಲ್ಲ ಕೂಡ ಕಾರಣ ಆಗ್ತಾ ಇದೆ. ಅದರಿಂದ ಖಂಡಿತ ಈ ಅಮಾಹಾ ಏನು ಹೊಸ ಸೌಲಭ್ಯ ಇವತ್ತಿಲ್ಲಿ ನೀಡ್ತಾ ಇದ್ದಾರೆ, ಭಾಳಷ್ಟು ಅನುಕೂಲ ಆಗುತ್ತೆ ನಾನು ಅಂದ್ಕೊಂಡಿದ್ದೀನಿ.
As has been famously said. So in a country that has a third of the global burden of depression, of addiction, of suicide cases, it's really for all of us to come together to take accountability and build care that is inclusive and that is, as Amit mentioned, human-centric, and that is looking at mental health not just as a subset of health, but as a development issue. After all, livelihood, education, gender issues, all of these play into mental health conditions, and better mental health impacts all of these aspects of our lives. We talked a little bit about working with children and young people, and many of us have been, like Amit mentioned, personal carers across our lifespan. I'm also one of those first unfortunate and then now very fortunate people to have actually gone through an entire journey right from the 1980s of a parent who has dealt with schizophrenia and continues to live with the illness, but is very stable and doing very well, and an active grandparent in her daughter's life, in her granddaughter's life as well, living with us in Mumbai. I'm also, I've been a carer for my younger brother who unfortunately died by suicide 5 years ago, and I think for lack of the care continuum that Amit talks about, for lack of quality facilities, and for our inability as a country to come together and just be human and recognize that everyone needs the kind of care and support we would extend to our family and friends. So it's been a dream that we've carried in our hearts for 40 plus years of our lives. Amit and myself, who went to the same high school in Delhi, perhaps
mental health hospital dedicated exclusively to inpatient care for moderate and severe psychiatric conditions. A space that was envisioned, planned, and built brick by brick to provide intensive, evidence-based, trauma-informed support to those in crisis. A place where comfort, dignity, and safety are not afterthoughts, but the foundation of the hospital. What we've created here is a 27-bedded, purpose-built facility that brings together psychiatry, psychology, occupational therapy, wellness services, peer support, and 24/7 nursing care, all under one roof. Here we are equipped to address a wide spectrum of psychiatric needs, like Sir said, from schizophrenia to bipolar disorder, to addictions, to ADHD, to treatment-resistant depression. We have cutting-edge technology like deep TMS, even ketamine-assisted therapies to deal with the most difficult situations.